Thank you, moderator. Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, and good evening, ladies and gentlemen. Let me introduce myself. I am Dr. LILIS HERI Cicih from Universitas Indonesia. Today, I am going to present about the impact of COVID-19 on older person life in Indonesia. I will present our study result partially due to limited time. Let me share our presentation. This is our title, The Impact of COVID-19 on Older Person Life in Indonesia. This is the content of our presentation, background, COVID-19 data, population trend in Indonesia, purpose of study, method of study, result of study, and the last is conclusion and recommendation. Background. As we know that COVID-19 was first identified in December 2019 in Wuhan, China. The World Health Organization declared the outbreak a public health emergency of international concern on 20 January 2020, and later a pandemic on 11 March 2020. The COVID-19 pandemic has led to a dramatic impact on human life worldwide and changing everybody living, include older person. Therefore, this is challenging to keep all the person to stay healthy and secure in fulfilling their needs. It's also to support the healthy aging decades goal. They need to be protected because most vulnerable group and at high risk of death due to COVID-19. Therefore, it is very important to know the condition of the older person during the COVID-19 pandemic. Why the older person? You can see here the picture that the older person are at the high risk of the COVID-19, especially for death cases. You can see here the graph, the data from the Ministry of Health Indonesia. And also, Indonesia changes in population structure encourage the population aging. In 2040, Indonesia facing aging society. You can see the picture that Indonesia double from 2020 to 2045 from the aging population. How about older person life during the COVID pandemic? For this, we collect the data on August until November 2020. We collected the data using online survey through collaboration with BKKBN all provinces. The data include the information about social, economic, demographic, health, and also knowledge and perception about the COVID-19. We use descriptive and inferential analysis, and for the independent variable, we use family income, health services, and conflict among family members. Next slide is about the characteristic of older person. From this study, we picked the 2,300 older person. Most of them are female, living in rural area, lower education, married older person, and young older person 60 until 69 years old, still independent, and most of older person living with their family are 3 generations, but we have still pay attention for other person who live alone. And around 66% of other person can fulfill their needs, and also 67% other person still healthy. But main disease suffered by older person is hypertension, diabetes, and heart disease. From this study, we also found that around 147 older persons need long-term care services. Although the percentage is small, but we need pay attention for the older person who are completely unable. How to provide the caregiver for them is provided by family or for professional caregiver. Okay, we move to the next slide. Is another our result of study. Around 96% of respondents claim the impact of the COVID-19 pandemic on their life. Infected their life is, for example, deteriorating in economic condition, their income. Most of other person decreases income more than 50%. And for the social aspect is a social relation, lack of social support, neglected, and often conflict with the family members, and also decreasing in other person group activities. Another impact is most of other person feeling very anxious. This is another result of study, correlation between independent and dependent variable. For the income and families conflict, the determinant variable is fulfilling their needs. And for the health services, is a determinant variable is education. And this is the conclusion and recommendation. The COVID-19 pandemic in Indonesia has severely affected all the person in terms of their life in health, social, and education, and also economic situation. It challenges how to increase education and older persons' support to fulfill their rights, include their needs, especially during the pandemic, and need to increase family resiliency to protect older persons from discrimination, abuse, neglect, and violence. Therefore, the safe and comfortable living in their families. And the last, need to enhance family and community empowerment to create income generating, especially for the lower income and education level. And this is our presentation. Thank you very much for your attention.